So basically now start another very topic of gingival enlargement. It is the types of gingival enlargement. So let's start it. Bismillahirrahmanirrahim. Okay. Inflammatory enlargement of gingiva due to gingivitis. When the gingiva inflamed or basically enlarged due to gingivitis. Clinical manifestations. Okay, so basically they are saying that all the changes that occurs in the gingival tissue is basically some degree of inflammation is involved in that case. Okay, it is might be a direct outcome of the gingivitis. Might the patient has the gingivitis, so there is the enlargement of gingiva. Okay. Mm. And with or without any complicating factors or involved of systematic condition, they are saying that there is no involvement of any complication or any systematic conditions. It is just a direct outcome of gingivitis that the patient have. So how will you see the patient? First you will do initial assessment by basically visual examination of abnormalities of the gingival contour, color and texture, which is very important and compared to the normal gingival contours, texture or color. Okay. Second, you will do the visual inspection, and then you will do a detailed medical history that include the potential of systematic factors and conditions. You will also see the dental history for any irregularities or habits like dysfunctional habits or okay. And also see the oral care efficiency. Basically it should be considered in evolution, and clinical measurements should be recorded. Okay. Now basically the inflammatory gingival growth, how it basically originate. It is basically a slight ballooning of the interdental papilla or marginal gingiva. Okay, so what happens, interdental papilla and marginal gingiva uh, have a slightly balloony shaped. You can see it here, that the interdental papilla and the marginal gingiva is involved and have you can see in this is a balloony shaped is originated in this region. Okay. Now in early stages what happens, there's a swelling that covers the involved teeth, and it increases in size and covers the parts of the crown. Okay, the gingival enlargement we have seen it can be localized or general, but it slowly progresses and painlessly unless there is any other complication like infection or trauma. Okay. What happens in chronic inflammatory gingival growth, there's a discrete sessile or pedunculated mass. Okay, means there's an sessile means it is directly attached, and pedunculated means it is through the stalk, the masses that resembles a tumor. Okay, basically the interproximal might be it is located or either marginal or attached gingiva. Painful ulceration can also be in this, which occurs in the fold that is between the mass and the adjacent gingiva. Okay. Now coming towards the etiology or causes. So basically it can be in acute inflammatory enlargement, the causes can be mechanical, chemical or physical. Okay. Mouth breathing can also be a cause. Impacted food items can also be a cause. Poor oral hygiene can also be a cause. Okay. And basically acute lesions are basically localized, they are seen, and marginally or papillary gingiva they are present, and the most common or the main cause of this is trauma. Trauma is by basically a traumatic lesion occurs when any foreign substances is entered into the gingiva and a complicated by resident microbes. Always remember then when there is a foreign substance entered into your body, it shows in a reaction. So it is like this, the same, that when a traumatic lesion or that is when a foreign substance is entered into the gingiva, so and also there's a complication complicated by resident microbes, means there is the formation of abscess, it can be also. Okay. Basically in chronic forms there is a granulation tissue formation and fibrosis basically, and there is acha. Okay, because nerve tissue does not proliferate, so pain is uncommon in this case. Okay, so always remember that basically mechanical, chemical and physical and mouth breathing, impacted food items, poor oral hygiene. Okay, and the main cause is trauma basically. And when traumatic lesions occurs when a foreign substance enter into the gingiva, and or it is complicated by resident microbes, means the microbes which is present there cause the complication. Okay, and chronic is characterized by formation of granulation tissue or fibrosis. Pain is uncommon because there is no proliferation of the nerve tissue. Okay.